Hello, my name's Clint Merritt. I'm an internal medicine physician and the chief medical officer at Augusta Health, and I'm very glad that we're working on an advanced directive project at Augusta Health this year. When we talk to clinical teams and we look at some of our challenging cases, we can tell that there's opportunity to learn more from patients and their families about their wishes for care, particularly when they're in declining health. And advanced care planning is a process where we learn from patients and their families what their wishes are when they're in declining health and the decisions are more challenging. And we try and have those conversations ahead of time. So one of the things we try and avoid is patients coming to the hospital, very ill, where maybe they don't have capacity and they don't have a decision maker identified. And then it becomes very hard to know that we're providing care consistent with what patients and families want. So when we do advanced directives, we're having really good conversations with patients and families to identify a healthcare surrogate decision maker, to understand if there are any treatments or therapies that they would want or would not want near the end of their life. And the goal here is to make sure that our care at Augusta Health is very much in line with what our patients want for their care. And we're finding a lot of engagement from our clinical teams. We have healthcare professionals who are asking to be trained as advanced directive facilitators. We are finding that we are receiving a lot of referrals from the community and from our clinical teams to population health for help with advanced directives. And we have community groups who are interested in teaching, us providing teaching about advanced care planning, and then helping their groups with filling out these documents. So we can tell from the response early on that this feels like very meaningful work for our community.
Hi, my name is Emily Back, and I'm a nurse navigator in the cardiology department. I started my nursing career here at Augusta Health on the progressive care unit, taking care of cardiac patients, and transitioned to the ambulatory care setting in 2018 when the congestive heart failure clinic opened. So for the last 6 or so years, I've been taking care of heart failure patients. And we work really hard in the clinic to partner with our patients, to provide them a resource to call, to give them an opportunity to connect and reach out if they have any concerns. These patients often will have exacerbations or flare-ups of heart failure, and so providing them an opportunity to connect with the provider is important. And so sometimes they will have worsening shortness of breath or edema, and that may impact their activity of daily living. And so when that happens, they may require a same-day appointment, or they may require an ED visit or an admission to the hospital. And heart failure is unfortunately a progressive and chronic disease. There's no cure. And so for patients, as the disease progresses, we'll have more frequent ED visits or more frequent hospital admissions or readmissions. And at that time, a lot of times the providers will have a goals of care conversation with the patient and their family members to talk about how to best manage their care. And so we're talking about advanced directives, and my frequently asked question is, what is an advanced directive? An advanced directive is a legal document that goes into effect if you are incapacitated or unable to speak for yourself, and this could be a result of a disease or an injury. So in this instance, for heart failure patients, when they're having more hospitalizations and visits to the ED, that's the time where the goals of care conversation come in, and if an advanced directive is already in place, that is helpful for the family members and the patients to have already made those decisions and how they want their care managed, so that the stressful and emotional time of a hospital admission, those decisions are already made for them.
Hi, my name is Benjamin Stovall. I'm a physician assistant with the Augusta Health Palliative Care team. So to kind of start off, advanced directives are extremely important for what I do with my job. One of the biggest reasons is listing a surrogate medical decision maker. If you're unable to make a decision, it gives us a place to start to contact a loved one if they aren't aware that you're in the hospital or there. Then additionally, they kind of serve as a blueprint or roadmap about how we can best care for you or your loved one. Kind of personally, I recently, both my parents completed advanced directives and sent them to me. And while a lot of my assumptions about what they would want for their care were correct, it was nice to see that written out. And so I would say it's also important to share your advanced directives with loved ones and with those who will be making decisions for you, and don't assume that they know what you want. I was asked to talk about some big decisions that may come up in a serious hospitalization, or if you or a loved one were near the end of life. One of the biggest things that's often asked is what we call code status. That tends to break down to a couple of decisions. One of those is a decision surrounding CPR. That can be a hard decision. Some people are very clear about what they want. So what that means is that if your heart stopped and you wanted CPR, then they would do everything they could to try to get your heart going again. That could include chest compressions and shocks and being on a breathing machine. And some people like to say, continue doing everything you can for me, but if my heart were to stop, allow me to have a natural death. And there's a lot of nuances to that discussion, and so that I can't get into in 3 to 5 minutes. And so, that's something, if you have more questions about, to talk to your medical provider about, and they can kind of navigate through what your hopes and concerns are. Another big decision is whether you would want to be intubated or not. So being on a breathing machine, having the tube down your throat, and the machine breathing for you. A couple of things to think about or ask with that is, that can be a temporary thing. If it's to protect an airway or to get you through an acute illness, that may be, only a 1 to 7 day thing. But for people with chronic lung conditions, that may be something that if you end up on it, may never come off of. So that's, again, something to kind of think about and talk about before it becomes a decision you have to make, right in that moment. There's also other decisions to be made around artificial nutrition. So like a feeding tube, there are several instances where that may make sense, like if you have esophageal cancer or a stroke that you're recovering from. But in things like end-stage dementia or the end of life, it can cause more distress and harm, and so it may not be something that is appropriate. We also think of things like artificial hydration, so IV fluids, and kind of a general broad thing called comfort care, which can bring up questions about whether to continue antibiotics or BiPAP or high flow, other interventions like that. What I would say that's important to think about too, and make sure you share with your providers if you have to make these decisions, is ask them about what their hopes are and maybe what your expectations are, and make sure those things align. Because sometimes when talking with patients, it doesn't seem clear why they want something, then it comes up that maybe they're waiting for a family member to arrive at the hospital or for a certain milestone to be met. So if there's something like that you're hoping for, it's important to communicate that and can help navigate those decisions a little easier. Because there may be things like antibiotics and IV fluids that prolong your life but don't necessarily cure what's going on, and that may be reasonable if there's something we're hoping to bridge to. And so a lot of nuances, a lot of hard decisions, and it's kind of a short time to give a 30,000-foot view of that, but hopefully that helps you understand and at least get a little taste of what those decisions might be for yourself or a loved one if that were to come up. And as always, your medical providers, the palliative care team, hospice team, there's a lot of people, chaplains who are available to help navigate those decisions and do that. So hopefully that helped, and thank you for your time.
Hi, I'm Joan Stalzer, and I'm a physician here at Augusta Health. I work as a hospitalist and sometimes in some of the clinics. And I think advanced directives are important because it gives individuals a chance to really think about and document what they would want for themselves in the event they became incapacitated, usually due to illness. Now, what is a healthcare proxy? A healthcare proxy is a person that an individual assigns and designates to be the individual to speak for them in the event that they lose medical decision-making capacity and they can't speak for themselves. This can be a close family member, a friend, or other loved one. And why is that important? So this individual or healthcare proxy would make important medical decisions for that person in the event that they can't speak for themselves. And this could include end-of-life decisions. And those kind of decisions would be spelled out and would be according to the individual's wishes in the advance directive.
Hello, my name is Megan Howe. I work in the quality department here at Augusta Health in the role of Quality Data Management Coordinator. Augusta Health has a mortality review team. We meet weekly to review deaths that occur in the hospital. Throughout this process, we commonly see patients without documentation on advanced care planning, goals of care, or advanced directives on file. If the patient is unresponsive or unable to make medical decisions, their care and decision-making is then placed on their family and loved ones. This is a stressful environment, and it's a difficult time to attempt to make choices on behalf of their family member. When I think about my family who resides in this community, I want to ensure that if a health-related event happened, they have a completed advance directive on file so that I can honor their personal care wishes. A frequently asked question on advance directives is, who should get a copy of your advance directive? It is important to keep an original for your records, but to also provide a copy to your healthcare agent or power of attorney, your primary care provider, as well as the hospital where your medical records are kept. At Augusta Health, if you bring a completed advance directive to your next appointment or during your hospital stay, a team member can ensure that it is scanned into the electronic medical records. You can also send a copy of your completed advance directive to the Health Information Management Department.
Hi, my name is Melissa Reeves. I am the office manager for the Augusta Health Neighborhood Primary Care Clinic. I am also an advanced care steps facilitator. The neighborhood clinic is special in that we take our care on the road and provide complex medical care to those in need by meeting them where they are. Advanced directives are crucial for the unhoused and low-income individuals because they often have limited access to consistent health care due to finances, lack of insurance, and transportation. Advanced directives are important to the neighborhood clinic and that we had a patient one time who was unhoused and did not have an advanced directive on file. He actually didn't mind being unhoused. He had family that he could live with but chose not to. He ended up getting sick and was admitted to the ICU for about 2 weeks. And we feel that because of his situation, he probably would not have wanted to be in the ICU for 2 weeks and not had made those decisions ahead of time. Unfortunately, that's what happened. He did pass away. So we have brought this to the forefront of our quality metrics this year, and we are 68 of 75 advanced directives that we are hoping to obtain this year for our patients. Some questions that come up often are, at what age should you complete an advanced directive? And that is anybody over the age of 18 should complete an advanced directive or at least start thinking about an advanced directive. Another common question is, how often should you update your advanced directive? And that should be at least once a year. You should review and update your advanced directive or any time in between if there are changes to your health or your healthcare agent.
Hello, I'm Kara Pacadomi, social worker with the Population Health Team. I've been working with patients in the community and within Augusta Health Hospital that have been interested or wanting more information about advanced directives. I believe that everyone should have a voice in their medical decisions, even when they are unable to do so for themselves. Advanced directives are good for the individual and family members so they are aware of their medical wishes as well. If you or a patient are interested in completing an advanced directive, you can reach out to Augusta Health provider or contact the Population Health Team directly at 540-332-4388. Also, don't forget the Wellness Fair is on October 28th from 7 a.m. to 5 p.m. and our team will be there where you can pick up an advanced directive, ask questions, or schedule a time to complete one.